Today, we join the world in observing World TB Day 2025, a day that reminds us of our duty to eliminate tuberculosis as a public health threat. This year's theme, yes, we can end TB. Commit, invest, deliver, calls on all of us to take decisive action. And the word here is decisive action and not rhetoric. TB remains one of the world's deadliest infectious diseases. In 2023, over 10.8 million people worldwide were affected and 1.25 million lives were lost. In Ghana, over 20,000 TB cases were recorded in 2024, a significant improvement in case detection, yet we still fall short of the WHO's target of detecting 44,000 cases annually. Too many cases remain undiagnosed, especially among children. In 2023, TB claimed 13,200 Ghanaian lives. This is unacceptable. We must act now. Stigma, limited access to diagnostic tools, and insufficient funding are major challenges. Addressing these barriers is critical to achieving our goal. Ladies and gentlemen, ending TB requires commitment from everyone: government, healthcare providers, civil society, the private sector, and the public. As a government, we are determined to increase funding for TB control activities, including essential logistics and medical supplies. Improve access to diagnostic tools like GeneXpect machines and digital X-rays. Strengthen healthcare system to ensure no TB patient goes undiagnosed or untreated. This government, under His Excellency President John Dramani Mahama, will continue to prioritize these actions. Investment in TB control and non-negotiable priority. As a ministry, our commitment remains strong. We will continue to allocate adequate resources for diagnostics and treatment. Strengthening our diagnostics and treatment capacity is vital. Whilst Ghana has made progress in making GeneXpect machines, digital X-rays, and laboratory supplies more available, access remains a challenge in some areas. Increased investment in TB diagnostics, healthcare facilities, and research in management across is essential for improving early detection and effective in the country. Invest in healthcare workforce development. Building the capacity of healthcare professionals is key to ensuring timely and accurate TB diagnosis and treatment. By equipping our workforce with the necessary skills and knowledge, we can improve outcomes for TB patients. Strengthen research into new treatment options and vaccines. Encouraging innovation through local research is crucial. Investing in the development of improved treatment regimens and effective vaccines will enhance our ability to combat TB more effectively. Yes, we can end TB. We are committed to achieving the end TB target by 2030. Partnerships are crucial. Collaboration with civil society and the private sector has improved community outreach and reduced stigma. We must expand these efforts to reach more people and save more lives. Ladies and gentlemen, today I ask you, the first question I'm going to ask is, what role can you play in ending TB? The second question is, can you raise awareness in your community? Can you support someone affected by TB? Can you encourage others to get tested? These are some of the roles we can play individually. As we mark World TB Day 2025, let this be more than just a day of speeches and declarations. Let today serve as a renewed call to action. I urge all Ghanaians and TB stakeholders to join us in the fight. Let us work together to raise awareness, support those affected, and advocate for the resources needed to end TB. Together, we can make a difference. Together, yes, we can end TB. We commit, we invest, we deliver. Thank you, and may we continue working towards a healthier, TB-free Ghana. Thank you for that. Yes, we are all committed in fighting against this disease, but let us also be very realistic. We are at a very crucial stage in the healthcare sector. A lot of partners are withdrawing their support, and therefore we cannot continue to do the same thing the same way to expect different results. And so let us think outside the box. The limited resources we have, let's be realistic. Our economy is not in the best of shape. So we are committed, we work with you. I mean, the disease does not know a minister or a president, but in the greatest respect, let's make judicious use of the limited resources available. I am a member of parliament. I'm a member of parliament in a rural community, and so we know what goes on. So please, let's go down there. The education, that is where we must target. Go to the various communities. We target the information centers. That's where we can get them on their farms. We must understand the country before we can win some of these campaigns. There are places where you cannot get more than 40% of the population in town after 9 a.m. There are places in this country where you want to capture this one too. So there are places where you cannot get more than 40% of the population in town after 9 a.m. and they will come after 6 p.m. So how do you get these people? So we must think outside the box and make judicious use of the limited resources available. And I am committed. And I've been committed since I became the ranking member of the Health Committee for the past 7 good years. Thank you very much.
Meeting has endorsed health as a key climate change component. And so we mandate to save our environment and the science. I hope you learn from it. Thank you. Let me personally begin by appreciating Honorable Dr. Marquette and then Honorable Kwabena Agbozo, the Minister of Health, for the role that they played during their membership on the TB caucus, parliamentary TB caucus, and the role that they played over the time. Now that they are the helm of affairs, a lot more is expected of them, and I'm sure we are able to meet all the commitments therefore, that has been made earlier. On this note, I have two main issues to speak about. Mr. Chairman, invited distinguished guests, the media, ladies and gentlemen. My first part is a very short message that we have to think through even as you are seated here. And the second part, I believe, will linger on after we leave this place. On this day, as a World TB Day, may I rather begin by referring to Dr. Eric Goosby, the UN Special Envoy on TB. TB's statement on TB in the era of SDGs, emphasized at the 2018 World TB Day event in New York that TB is a global health emergency that requires immediate attention and action. This, I believe, to a great extent, is one of the underpinning elements for this year's World TB Day theme, which goes as: yes, we can't end TB, commit, invest, and deliver. Let me bore you a bit with some global statistics. Currently, 79 million lives saved since 2000 by global efforts to end TB. 10.8 million people fell ill with TB in 2023. 1.2 million people died of TB in 2023. And I believe this is why we, the civil societies in Ghana, commit to encourage world leaders meet pledges made at the 2023 UN High-Level Accelerated to accelerate efforts to end TB now. We, civil societies in Ghana, will invest in training, in advocacy to ensure innovative and proper financing mechanisms exist to defeat TB. We, civil societies in Ghana, will advocate at all levels to deliver by turning commitments into actions by means of scaling up proven WHO recommended interventions, that is, early detection, diagnosis, preventive treatment, and high quality TB care. Mr. Chairman, ladies and gentlemen, the World Health Organization new guidelines for TB encourage for the first time use of computer-based diagnosis. And in Ghana, we CSO community are excited to partner TrueNut with their community-friendlier diagnostic tools. We are also very glad to have partnered Cure AI for improved gene expert diagnosis. Mr. Chairman, that ends my first statement. I'll move on quickly to my second part. Today, we shine a light on those unseen, the forgotten ones who suffer in silence serene, their voices whispered, their stories untold. We remember them with hearts that are bold. 1.5 million lives lost, a sorrowful refrain. Yet, we honor the brave who fight against the pain. Their resilience inspires and courage ignites a beacon of hope in the dark of nights. We celebrate community strong and true, bond of unity that sees through. Access to healthcare, a right for all, a promise of dignity that stands tall. Human rights shine bright like a guiding light, illuminating the path to a brighter sight. Let us recommit to ending TB's sway and bring hope to those who face each day. Together we can make difference so grand, ensure quality healthcare across this land, regardless of background or circumstances so rare. We care for each other, we love and compassion we share. We can end TB, we must, we will. It's true, a promise to ourselves to see this journey through. Let us unite in this noble quest, so bright to eradicate TB and fill our lives with delight. Act now, invest now, deliver now. Together, we can end TB. Let's protect, defend, and help realize the CID. Commit, invest, and deliver. Thank you.
With the current minister and others, we launched the TB caucus in Parliament, and I was made a focal person. And we have since then been involved in TB activities. Indeed, in 2023, we were part of the delegation that went to New York to commit the country to increase funding for TB. After all, a sickness that can easily be diagnosed, treated, prevented, and yet, as we speak, globally, it has overtaken both malaria and HIV as a public health menace. If you look at the statistics, I'm not going to go into detail. I've seen that my minister's name is there, and then the Dr. Edusai Poku, is it Edusai? Edusai Poku, their names are on the program, and I believe they'll give you detail. But TB has overtaken malaria and HIV so far as the public health menace is concerned. Then from malaria globally is stated around 597,000, TB 1.2 million, and HIV 630,000. So obviously TB has overtaken it. And yet, in the planning baskets, we find TB always wanting. I hope that we'll take notice of this. Parliament, whether you like it or not, we always get involved. Because all the money that you sit down and discuss, finally has to come to the health committee, and from there to the floor for approval. And so we need to understand, and I pray that you involve the health committee in your activities so that we'll understand some of the issues. The health committee is not made up of only doctors. We are a variety of professions that are there, and sometimes it's difficult for us to understand the money that you want to collect. Yes. And when it becomes very, very difficult, we have to vote. And if somebody or some people do not understand and they vote against your allocation, then that is it. We cannot increase your allocations, but we can reduce it. So let us always involve Parliament in activities of all the agencies of the Ministry of Health, and then the Ministry of Health itself, and let us just understand what you are doing, and we will make sure that you get what you want. Because after all, we want to improve health. So if the allocation for health is high, then obviously we will have the health system operating better, and we can improve the health of our people. Remember that health is wealth. Thank you very much.